Good morning. I'm Russell Myers, CEO of Midland Health, and this is our coronavirus daily update for Monday, April 20th. Starting with some numbers in Texas, we are just short of 19,000 cases now confirmed across the state. There have been 477 deaths so far, according to the DSHS website. Midland County has 42 confirmed cases, and there have been 3 deaths in our county. The hospital has had a significant uptick in testing after our team went to the Midland Medical Lodge on Friday and tested essentially everyone at that site. So we've now tested more than 1,150 cases. We've had 50 positives, some of those from outside of our county, 900 negatives, and we're waiting on results for over 200 patients now, almost all of those from Thursday and Friday of last week. Hospital census is 109. We saw only 79 patients in the emergency department. And to give you a reference point, this same day last year in 2019, we saw 176 patients in the ER. So 100 plus fewer than last year, less than half last year's volume. In the hospital, the critical care unit has 9 patients total. 7 of those are persons under investigation for COVID-19. We have 16 more of those patients in the medical surgical environment for a total of 23 persons under investigation. 6 of those are confirmed positive for COVID-19. The big news last week was the governor's press conference on Friday and his announcement of 3 new executive orders. I'll tell you a little bit about each of those and their impact on the hospital. The first is the appointment of a strike force to get the economy moving again. The governor appointed a large group of both healthcare professionals and business folks and state representatives to his strike force with an intention of getting the economy and the state back up and moving as soon as possible. We expect to see that they'll be meeting on a fairly aggressive schedule and making recommendations to the governor. He did state that he expects to have some more announcements on the 27th, which is a week from today, and then more further into May. Our own Don Evans, a member of our Board of Governors and former Secretary of Commerce, a very active and successful Midland business person, is one of the members of the strike force. The second executive order was regarding retail to go. You can get the governor's orders on the state website. The retail to go concept essentially opens more stores beyond the original essential group, but gives them some pretty direct guidance on how to deal with their customers, encouraging them to keep customers out of the stores, to practice careful personal hygiene among the workforce, to deliver packages that are ordered either online or by phone, to deliver those directly to customers' cars. So a very slow movement into the reopening of the retail world beginning immediately. And then the one that's of interest to us is the third executive order, allowing for enhancement of elective procedures, really for hospitals and surgery centers to return to doing elective procedures beginning on Wednesday. This order runs through May the 8th, at which point I assume it will be reevaluated. And the key change from the original restrictions is that it really opens the door to the performance of elective procedures in cases where they will not deplete the supply of personal protective equipment for a hospital, and they will not deplete the inpatient bed capacity needed to manage COVID-19 patients should a further spike happen in the days ahead. We think those are important changes, and we have begun serious conversation with all the procedural specialties that work in the hospital, and to the point that we were prepared to move forward with loosening our restrictions on elective procedures as soon as this week. Unfortunately, last week's significant increase in cases, especially the outbreak at the Midland Medical Lodge, has caused us to slow that process just a bit. We will be evaluating where we stand as the test results come back early this week. You may recall that on Friday we sent a team to test all the patients and most of the staff at the Midland Medical Lodge. Those results are still pending. We hope that tomorrow, perhaps today, but no later than tomorrow, we'll have the majority of those test results back. We'll use that to inform our decision making with regard to reactivating elective procedures. We hope that that can still take place in the next few days. Certainly our surgeons and our GI doctors and our cardiologists and others need to get back to work. Their patients have been waiting in many cases for surgeries that could be postponed, but are still very much needed, surgeries and other procedures. And of course, the hospital has serious financial concerns as those elective procedures are the economic engine that drives much of what we do. So we have lots of reasons and lots of motivation to return to doing elective work, but we intend to be very thoughtful and careful about that, and we will not allow it to jeopardize our ability to respond to the pandemic. From the beginning, those conversations with our surgeons and others have included a plan to do a regular conference, a couple of days a week at least, among the proceduralists and the anesthesia providers and our nursing leadership and hospital administration, all with the intention of assessing any risk that we might continue to run and adjusting the schedule in accordance with that risk. So that's what's ahead of us. As I said, the governor's order runs through May the 8th, at which point it would be reevaluated. And we hope that later this week we'll be able to tell you exactly what our plan is and when we expect to open the doors to a significantly greater number of elective procedures here in the hospital. My last point today, I'd like to talk a little bit about recognition for our unlicensed and our certified personnel that do so much of the frontline care, personal care, or patient care assistants, certified nursing assistants, emergency medical technicians throughout the hospital environment are important frontline caregivers delivering much of the hands-on care that every one of our patients requires. And I'm particularly reminded of the importance of certified nursing assistants as we deal with the outbreak in the nursing home environment and the potential, the risk that those environments run for the whole healthcare system. In a nursing home, a certified nursing assistant is the frontline care provider. And there is no more important person right now involved in the chain of prevention than that certified nursing assistant in a nursing home environment. So I'd like to say thanks to all of those people working in our environment, in all the nursing homes in our community. It's hard work. It's very, very vital work in the care and the service delivered to patients who need it. And we can't thank those hardworking folks enough for the work that they do. So that's the extent of my remarks for today, and I'll be happy to take questions.
Okay, from Facebook, it's regarding antibody testing. I keep seeing that COVID-19 antibody tests are in the works, and they mention a blood test exhibiting IgA and IgG immunoglobulin. Sorry, thank you, Dr. Wilson. Antibodies. If they're testing for antibodies, how do they know if they are from a COVID-19 recovery and not just the flu or even a flu shot?
I'll let Dr. Wilson come try to answer that, but I will tell you that we don't have any antibody testing available yet. If you're anticipating that, you're going to be waiting for that for a while. Dr. Wilson.
Yeah, thank you, Russell. So the antibody testing is for IgM and IgG. IgM is the initial response to the body to a virus, and IgG is the long-term memory cells, if you will, that will protect you for a longer period of time, and the ones that we're trying to generate with the vaccination that we hope to have sometime in the future to support us in the cure in the long term. In the short term, the antibodies that you have are actually specific for the type of virus or the type of antigen, if you will, or the target spot on any cell, whether that bacteria or viral. So the antibodies that one might have for other viruses, even the other species of coronavirus that you have heard about, and you remember we have spoken about before, it's about 4 species of coronavirus that are around that can cause just a common cold. The antibodies that treat that don't necessarily treat the SARS-2 virus, the one we're concerned about. So you need specific antibodies for specific viruses.
Okay, thank you, Dr. Wilson. Other questions?
We have a question from Mitch. Has a hospital heard from any nursing homes in Midland other than Midland Medical Lodge concerning their residents developing COVID-19 symptoms over the weekend?
The short answer to that is no. I think we talked about this on Friday. We have been fairly aggressive in making contact with the nursing homes in our community and throughout the region, encouraging them to stay in touch with us. Our case management team did that work last week and did a great job getting around to everyone and has actually built a database of who the contacts are, what their situations are, and we'll be updating that regularly. But so far, Midland Medical Lodge is the primary area of concern.
Sammy has a question. Sammy, go ahead.
Wondering, can y'all hear me?
Yes.
How many people from Midland Medical Lodge have tested positive who are not Midland County residents?
Did you say how many who are not Midland
Yeah.
County residents?
Yeah.
I don't know the answer to that, but once you live at the medical lodge, you are a resident in our community. So should be 0 unless by chance it's a worker who lives
Yeah.
there.
So I'm wondering if like staff or employees who maybe live in Ector County or, in another county, if that changes the people number.
Sammy, I think that's probably information we can get, but I don't have it available just now. So.
Okay, that's all right. Thank you.
Okay, we have a question from Caitlin from the MRT. Are there any more PUIs from Midland Medical Lodge who have been admitted to the hospital? And then I'll ask her second question in a minute.
Admitted over the weekend, I presume is what she means?
Yes, sir.
Yes, just one over the weekend beyond the ones we already had. And we think there's one in the emergency department right now. So there's been a handful, yes.
Her follow-up question is, are there more residents from Midland Medical Lodge who have been isolated at their facility?
As I understand it, Midland Medical Lodge has an isolation wing, and they are taking patients who show signs and symptoms that are suspicious for COVID-19 while they're awaiting testing results and managing those cases, much like we've recommended that people do if they have signs and symptoms and are not sick enough to come to the hospital. They stay away from others. They practice careful personal hygiene. The staff practices careful PPE usage, et cetera. So that unit is in place. They do have several patients on it, as our understanding. And all of those patients have been tested. Most of them, the results have not been returned just yet.
That's all the questions we have.
Okay. Well, thank you all very much. And we'll be back tomorrow with the Unified Command Team briefing, same time. Thank you very much.